Hi, I'm Dr. Rachel Tate, presenting live from Rheumatology Winter Clinical Symposium 2017, and I have the distinct pleasure of interviewing for @rheumnow.com Dr. Megan Lynch from Scripps. So, Megan, what brings you to Rheumatology Winter Clinical Symposium in beautiful Maui?
The conference is really great for fellows. It gives us an opportunity to present interesting cases. So I was able to come and present my poster on a very interesting case of chloroquine cardiotoxicity. A patient actually presented to our hospital, unfortunately, in florid heart failure for evaluation of possible heart transplant. She had been started on chloroquine by an outside rheumatologist years before for possible lupus. So we had suspicion that her cardiomyopathy was secondary to chloroquine. She underwent an endomyocardial biopsy in our hospital, and she had the pathognomonic findings of curvilinear bodies and lamellar bodies on her endomyocardial biopsy. So that kind of clinched the diagnosis. Luckily for her, she had stopped the medication before she got to our facility because there was a shortage of the medication. But in any patients that you even suspected, that's going to be your first line that you need to do is stop the medication. It's questionable whether or not the effects of the medication are reversible, so you really need to stop it immediately. Other highlights with this is that there's often a delay in diagnosis. One of the first findings you can see in these patients is AV conduction abnormalities. So if you have a patient who has any of those symptoms, kind of prompt yourself to think, could it possibly be, hydroxychloroquine or chloroquine? And the other thing is that you need to let your pathologist know that you're concerned for this, because the lamellar bodies can also be seen in Fabry's disease, and so you kind of need to let them know, hey, this is kind of what we're thinking. So those are kind of the key highlights, and thanks for having me.
Absolutely, Megan. Thank you so much for joining us in Maui this year, and I appreciate all of your expertise on the matter. So we're looking forward to great things for you in your future. Aloha!